Since the close of the last legislative session, our state and our sense of normalcy have shifted immensely.
Even before COVID-19 came into our lives, we were gripped by a mental health epidemic deeply affecting communities across Texas.
The physical, mental, and economic consequences of COVID-19 have exacerbated the mental health crisis impacting communities all across Texas.
NAMI Texas affiliates are resolute in our belief that mental health must be a top priority.
We support increased funding for outpatient care. Failure to invest in these services is penny wise and pound foolish.
We support investments in psychiatric hospitals, supporting a continuum of care. No one should have to wait in jail for mental health care.
We support early mental health intervention for children, adolescents, and their families. People with other conditions get access to early care.
But on average, individuals with mental illness wait 8 to 10 years to receive the services and support they need.
When we hashtag Act for Mental Health and invest in evidence-based services, individuals avoid negative outcomes like criminal justice involvement.
40% of prisoners and jail inmates have experienced mental illness. Mental illness is not a crime.
Texas must act for mental health to support engagement and services prior to the criminal justice system. Our jails and our prisons should not be our largest mental health facilities. We need care, not handcuffs.
1 in 5 adults experience a mental health concern in a year, and expanding insurance coverage is an important step in increasing their access to care.
Mental illness can contribute to housing instability and homelessness.
Texas should invest in housing, ancillary supports, and community-based services across the state.
Members of vulnerable and marginalized communities often experience barriers to accessing mental health care.
Targeted interventions that reduce disparities in access can improve the mental health of those most in need.
A strong response to a mental health crisis is critical to starting a person down the path to recovery.
Texas should develop a coordinated system across the state for mental health crisis and suicide prevention calls.
It has never been more important for the Texas legislature to act for mental health.
Across the state, the 27 local NAMI affiliates stand with NAMI Texas in advocating to better the lives of people affected by mental illness.